Hypertension is an important problem throughout the world. When we call it hypertension, when the blood pressure level is more than 140/90, then we call it hypertension. But American Heart Association in November 2017 told that when the blood pressure is more than 130/80, it is hypertension. It is the level of blood pressure that reduction of which causes clinical benefit. 50 years back, hypertension was declared when it was 160/110. But nowadays it is 130/80, but conventionally 140/90. The hypertension is mostly primary when there is no cause is found. In more than 90% cases is primary. There are also some secondary causes like renal cause, renovascular cause, renoparenchymal, obstructive sleep apnea, endocrine cause like Cushing syndrome, primary aldosteronism, coarctation of aorta. For hypertension, most important point is the first diagnosis, because many patients are not diagnosed because they do not check their blood pressure. Once even they check their blood pressure, they are not taking adequate drugs and duration, and they sometimes they stop taking the drugs. That is the main problem throughout the world. And it has been found that even in US, where medical facility is so much, in spite of that, only 30% of the population is controlled. Hypertension is controlled. Hypertension may not cause any symptoms. That is the most important point. Unless we check it, it may not cause any symptoms, but in some patients, it may cause some dizziness, some headache, some unusual problem, the palpitation. This problem can occur. So thorough clinical examination and evaluation is very important at the first onset, whether we are missing any secondary causes of hypertension. Just like palpation of the dorsalis pedis pulse, absent pulses indicate that this patient may suffer from coarctation of aorta. Any bruise over the renal artery may indicate that it is a case of renal artery stenosis. In that way, the patient comes with a weakness, lethargy, and the potassium is low. The low potassium, they may indicate the patient is suffering from primary aldosteronism. In this way, secondary causes is diagnosed early and secondary causes removed, then hypertension can be cured. One of the important causes is obstructive sleep apnea. Many patients are obese. In this age of digital generation, many patients are obese, that causing obstructive sleep apnea, that is causing hypertension. We have to investigate the patient thoroughly, starting from complete blood count, serum creatinine, potassium, lipid profile, chest X-ray, ECG, echocardiography, and this way we'll diagnose whether there is any secondary causes. And also we have to do other important secondary tests, like when we suspect like 24 hours beta-nephrin, our renal Doppler studies and other studies to rule out any secondary cause of hypertension. Once hypertension is diagnosed and investigated properly, then management starts. Management is actually three-way. One is diet control, DASH diet, that Mediterranean diet, no extra salts. Extra salt should be avoided. Only the salt that is used in cooking, that should be given. And patient should regularly walk. The lifestyle modification is very important. Lifestyle modification is 30 minutes walk per day, 150 minutes per week. Regular intake of blood pressure. When we can stage the hypertension in stage 1 and stage 2. 140 systolic 140 to 159 and diastolic 90 to 99 is stage 1. And 160 millimeter mercury and above and 100 millimeter mercury and above is stage 2. When you diagnose a patient with stage 2 hypertension, you usually start with the two drugs, amlodipine and ARB or ACE inhibitors. And when you diagnose as a patient of stage 1 hypertension, usually you start along with only one drug. If it is below 55, we start ARB. And if there is other comorbidities like diabetes, also we prefer ACE inhibitor or ARB. And if there is a prostatic hypertrophy, benign prostatic hyperplasia, we use alpha blocker. We also when we call a patient suffering from resistant hypertension, when more than 3 drugs are needed, one of them with the drug is diabetic, then you call it resistant hypertension. In resistant hypertension, sometimes a patient coming to us with chronic kidney disease is very difficult to treat and very difficult to control hypertension. We have to sometimes use 4 or 5 drugs. We tell the patients that you take this amlodipine in the morning, you take the ARB in the night. In this way, you divide the drugs so that the blood pressure is controlled. Unless the blood pressure is controlled, there is chances of complications. Complications, there may be cerebrovascular accident, myocardial infarction, there may be central retinal artery thrombosis, there may be peripheral vascular disease, and many other complications. So it is a very important problem in the earning population. Those who are family member got hypertension, undetected hypertension, and complications like CVA, myocardial infarction, the whole family is jeopardized. So hypertension control and diagnosis is very important. We have to also keep in mind pregnancy and hypertension. Some patients are diagnosed hypertension during pregnancy. During pregnancy, we have to keep special care, and we have to also use special drugs like labetalol, alpha methyl dopa. If the patient is suffering from hypertension pre-pregnancy level, then we give some drugs like amlodipine so that these drugs can be continued. We avoid ACE inhibitor ARB during pregnancy. Also, we tell the patient, some of the patients, we have follow up the patient. Some of the patients have become normal blood pressure after pregnancy is over, after delivery. Some of the patients may continue to have hypertension, and we have to treat the patients. Some of the patients with hypertension during pregnancy may come with preeclampsia and eclampsia. Preeclampsia is after 20 weeks. There is proteinuria, there is hypertension, and there is and eclampsia. If there is conversion, we call it eclampsia. So diagnosis of hypertension and management is very important. We have to convince the patient what is the importance of hypertension, and you have to stick with the blood pressure drugs, and you have to follow the drugs properly, and take and checkup is important. Whether the patient is developing any complications, we also check for any proteinuria. Some of the patients may develop proteinuria. That means renal damage is already started. And some of the patients also develop diabetes during hypertension. So control of hypertension, control of diabetes, control of dyslipidemia, control of weight, all these parameters are very important. We have to convince the patient that this is a problem. You have to, throughout the life, you have to take the drugs, and also under the physicians. If the physicians think that your blood pressure is now controlled, he can stop the drug. You will not stop the drug on your own. That is very important. And we have to keep the awareness is very important throughout the society, that this awareness is hypertension is a major killer of our whole civilization. Hypertension, diabetes. We have to diagnose the patient's hypertension as early as possible and continue these drugs throughout the life. And we have to involve all the social workers, NGOs. It's a problem throughout our world, so we have to involve all the populations so that we can control the blood pressure, diabetes, and other complications, that non-communicable disease throughout the world. Thank you.